Welcome to our program today. Hepatitis C is a viral infection that impacts an estimated 3.5 million people in the United States. The landscape of HCV treatment has evolved over the past decade significantly. Our panel of experts from around the country will provide a better understanding of the common misconceptions behind hepatitis C and the barriers to care for our patients. They will share their best practices for the treatment and management of hepatitis C. I'm Dr. Christian Ramers, an associate clinical professor at the University of California, San Diego School of Medicine, and an infectious disease specialist at the Family Health Centers of San Diego in San Diego, California. Today, I'm joined by my colleagues, Dr. Caroline Derrick, an assistant professor and infectious disease pharmacist at the University of South Carolina School of Medicine in Columbia, South Carolina, Dr. Chris Holstein, a clinical pharmacy specialist at the University of Colorado Hospital in Aurora, Colorado, and Bhavesh Shah, the Senior Director of Specialty Pharmacy at Boston Medical Center in Boston, Massachusetts. Thank you for joining us. Let's begin. So we're going to talk about hepatitis C throughout this discussion here, talking about misperceptions and the treatments that are currently available, as well as barriers to access. But before we jump in, let's start with a general overview of hepatitis C in terms of the transmission, risk factors, the prevalence around the country, and what % of patients we think are still undiagnosed. Chris, you want to start?
Yeah, absolutely. So hepatitis C is a blood-borne viral pathogen. So typically when we think about transmission, it's related to risky behaviors surrounded around blood. Now, currently the prevalence is around 3.5 million, kind of depending where you're actually looking within that data, but we do think that that data is largely underrepresented. We do think that maybe about 50% or so of patients are left undiagnosed from hepatitis C. Some of the risk factors for the viral infection itself, again, are related to blood exposure. And screening for those particular patients are any patients with IV drug use, illicit drug use from a nasal perspective, incarcerated patients, and the screening criteria that are a little bit now dated largely focused on the baby boomer population as well for a number of reasons. In large part, it comes from the NHANES database and recommended screening for patients who were born between the years of 1945 to 1965. Unfortunately, the way that that was conducted was actually largely underrepresenting patient populations like the homeless, IV drug users, those who are incarcerated. So those very high-risk populations were very underreported and really need to be included as part of that screening.
And in your clinical practice, do all of your patients identify a single risk factor that put them at risk for hepatitis C?
No, actually, it can be kind of difficult to narrow that down for certain patients. There are some patients where it's very clear what their exposure had been, but many patients who have presented to clinic may not be aware that they have had the virus and don't know how they got it. It easily could have been that they had received blood product prior to the 1990s. There are coagulation factors in the 80s as well that were infected. They may have shared a needle or a razor with somebody way back in the day, and it's just not a very clear picture as exactly how they may have gotten it.
Possibly related to that 50% undiagnosed rate.
Exactly.
Right?
Yep.
Okay.